Bismillahir Rahmanir Rahim. I am Dr. Nizamuddin Uthmani and I am working as Assistant Professor in the Department of Pharmacology, Khyber Medical College, Peshawar. I am teaching pharmacology and I am practicing medicine and gastroenterology. Today we are going to discuss a very, very important topic, and that is the clindamycin and lincomycin. These are the two very, very important antibiotics, and we are going to discuss these antibiotics. What are the learning objectives for today's lecture? Describe the clindamycin and the lincomycin, then describe their mechanism of action, then describe their clinical uses, their adverse effect, and of course mechanism of resistance to these two antibiotics. These two drugs, the lincomycin and the clindamycin, they belongs to a group of antibiotic, what we call it the lincosamide. Mechanism of action is same as that of the macrolide. They basically bind to the 50 subunits of the ribosomes, and they just block the initial process of protein synthesis, and by this mechanism they work as a bacteriostatic antibiotic. They are given parenterally, and as well as we can give it orally, but most of the time we usually give these drugs parenterally. And they undergo extensive hepatic metabolism, and they are excreted both by biliary as well as by the renal pathway. We are using these drugs for severe type of infection, especially the skin infection and the soft tissue infection, especially those infection which is caused by the gram-positive bacilli and gram-positive cocci. We are also using it for a number of gram-negative infection as well, but most of the time we use these drugs from the gram-positive for the infection which is caused by the gram-positive cocci and bacilli, especially the upper respiratory tract infection, the lower respiratory tract infection, and the urinary infection. They can also be used for the pneumocystic cerevisiae pneumonia, especially in those people who are HIV positive and who present with AIDS. It can be also used for the abdomen and gut wounds, especially for those people who get dirty type of wounds. We can use these drugs for the treatment of severe type of intraperitoneal infection. And of course we can use these drugs in female for the genitourinary tract infection, especially the pelvic abscess. Side effect. Now coming to the side effect, this is very important. You know, these drugs, they can cause nausea, vomiting, and they can derange liver function tests, and they can cause antibiotic associated diarrhea. But this antibiotic associated diarrhea can sometimes become very much severe, what we call as the pseudomembranous colitis, which is considered as a severe inflammation of the gut, which is characterized by the diarrhea, pain, abdomen, fever, and vomiting. So usually such sort of severe pseudomembranous colitis, it usually occurs with this drug because it kills all the microbes. It kills even the normal probiotic flora in the gut. So that's why the people develop opportunistic type of infection because of the Clostridium difficile, which lead into the pseudomembranous colitis. And we treat the pseudomembranous colitis which is caused by the Clostridium difficile with the help of vancomycin and bacitracin. Both of those antibiotics, they are not available in oral form, but we formulate those drugs from the injection into an oral form, and we use that for the treatment of pseudomembranous colitis. With this, I came to the end of today's presentation on the clindamycin and lincomycin. These drugs, they are very much misused drugs, especially by these dispensers. They use these drugs for the upper respiratory tract infection, and even a single injection is enough to treat the pharyngitis. But after their single injection, the people usually develop the pseudomembranous colitis or antibiotic associated diarrhea, and then they visit to the multiple physicians just for the treatment of diarrhea. So whenever you are getting a patient with a chronic diarrhea, you must ask about the use of the clindamycin or the lincomycin, what we call it the lincosine injection, because in peripheries at the level of the dispenser, people usually prescribe these drugs which are really dangerous for routine use. Thank you very much. God bless you all.